The following is the published article by Dr. Ronald Simons, reproduced from the Appendices of Kurt B. Maxwell's 1978 collection, Selected Historical Cases in Abnormal Dreaming. Boston Medical and Surgical Journal, Volume 144, Number 6, February 7, 1901, page 153. A Case of Persistent Dream Phenomena in a Neurasthenic Subject, by Ronald Simons, M.D., Boston. The following notes concern a patient presenting certain unusual dream phenomena observed during the course of what was otherwise a typical neurasthenic condition. The case is recorded chiefly on account of the persistence and coherence of the dream state, rather than on account of any novel theory to which it may give rise. The patient, a male clerk aged 32 years, of good habits and sound education, came under observation in August 1900, complaining of mental fatigue, disordered sleep, and anxiety in connection with occupational strain. Physical examination was negative, and no hereditary nervous taint could be elicited. There was no history of alcoholism, epilepsy, or prior mental disorder. The principal symptom consisted in a dream which occurred nightly with little variation. The patient asserted that interruption of sleep did not dissipate the dream, but that upon resuming sleep he found himself again within the same imagined surroundings. These surroundings were described as an extensive interior structure composed of rooms and corridors, devoid of emotional or symbolic content. The patient did not experience terror, pursuit, or moral distress within the dream. During September, the patient began to record the dream in writing, producing brief descriptions and diagrams of the imagined structure. These records were examined on several occasions and were found to be consistent across time. No disorder of perception or judgment was demonstrable in the waking state, and the patient continued his employment with only minor lapses attributable to fatigue. In early October, the patient reported an increased vividness of the dream and the impression of an additional element within it, which he described cautiously and without elaboration. Shortly thereafter, he experienced an acute but transient physical illness characterized by vomiting, fever, and marked prostration. No adequate somatic cause was determined, and recovery was prompt. Following this episode, the dream continued for several weeks and then ceased abruptly in December. The patient's sleep thereafter improved, and his former anxiety diminished. At the same time, a slight alteration of demeanor was observed, consisting chiefly in emotional flattening and a certain detachment, though no impairment of conduct or intelligence was apparent. Observation terminated early in the following year owing to the patient's removal from supervision. No conclusion is offered regarding the ultimate nature of the condition. The case is submitted as an instance of persistent dream activity occurring in association with neurasthenic symptoms, and as illustrating the need for further study of such phenomena.